Now, back to health and wellness correspondent Lee Kelso.
Great to have you back with us for the second half hour of the broadcast. We are talking this half hour about what's going on in your mouth, and it's all because I found a couple of studies. Well, the studies found me, actually, this week. They're pretty serious studies indicating that the bacteria that forms around your teeth has a significant impact on your health beyond your teeth. For example, the study strongly suggests that low-grade chronic periodontal pathogen infection can result in the development of neuropathology that is consistent with that of Alzheimer's disease. Now, let me decode that for you. What that means is the bacteria in your mouth tend to create an inflammation process that causes the bacteria to get across the blood-brain barrier, and they think that is one of the many factors that contribute to dementia and Alzheimer's disease. Pretty frightening if you haven't been to the dentist for a while. And so when I saw this, I asked Dr. Dave Diehl from Dupont Family Dentistry to join us and talk about this whole issue around bacteria in your mouth and how harmful that is to way beyond your teeth. So, Dave, thanks for coming in.
Hey, thanks for having me, Lee.
So part of the problem here, let's walk this through. So you get this bacteria that forms along the gum line, and then what happens?
So, at an early stage, it's not such a big deal. You brush your teeth at the end of the day, and it goes away. But as you let that build up, and it becomes more and more established, it adheres more strongly to the teeth. It's there more, for longer periods of time where you're going to have a professionally removed. If it goes beyond that, the type of bacteria that's in our mouths, we have thousands of bacteria in our mouth. You start changing that flora, that type of bacteria. And there are some very pathogenic types of bacteria that develop. Early on, they're not there, but in later stages, they are. When they develop, it's just like a lot of other bacterial infections. They're kind of hard to get rid of. But the very pathogenic ones are the ones you don't want to see. And in later stages of periodontal disease, they cause all kinds of issues. And like you're saying, we're always discovering new things. Dementia and Alzheimer's is a newer one that we've been talking about a lot lately. And it's significant. It's serious. And the crazy part of it is it's easily preventable. You can avoid all this stuff just getting your teeth cleaned on a regular basis.
We'll talk about that in just a second. Now, I want to just be very upfront about this. One of my goals today is to frighten you folks who haven't been to the dentist to get to see a dentist. Of course, Dr. Diehl is seeing new patients, but it's not his mission to frighten you to come in and see him. That's my mission.
I'm more motivating.
Right. But I want to scare you because this is becoming so much more evident. We're seeing inflammation-related stroke risk, heart attack risk. If you have diabetes, I understand it's more difficult to control your insulin. All of this is tied to the bacteria that is in your mouth.
Absolutely.
It's fascinating.
It is fascinating. And again, it's one of those things that, as our health deteriorates, as we get a little bit older, it deteriorates in a bad way, but as things change, you assume these things are normal. This is a normal change for you. In reality, it's not. There's so much that we can do to, prevent this from happening, maintaining the good health that we want to have. And all you got to do is, put some regular effort into it.
Yeah. So the process is this bacterial film forms along the gum line.
Yes.
And then it gets below the gums. And if it progresses enough, you get into something called periodontal disease.
Yes.
Tell me about that.
So periodontal disease, different types of bacteria. You can put them broad categories. You're going to have aerobic, they like oxygen, and anaerobic, they don't like oxygen bacteria. Typically, the pathogenic ones that are going to cause problems are anaerobic. So you start going below the gum line, there's less and less oxygen. It promotes the health of these bacteria that don't like oxygen. So when we're not flossing, we're not getting oxygen in there on a regular basis, they proliferate. That type of bacterial infection then leads to bone loss, gum recession, periodontal disease, that classic thing. When those things happen, in the past we used to think in terms, there's damage to the bone, there's recession of the gum, and that's irreversible, but you can maintain it. But nowadays it's all about, wait a minute, those bacteria do a lot more than just cause gum disease. Get into your blood system. Every time you brush your teeth, your gums are bleeding. That bacteria gets into your blood. It goes somewhere. It goes to your heart, goes to your brain, goes to your organs, wherever. And that's where the real damage comes from. That's where it all originates from. Now, of course, there's versions of diseases that don't come from that, but
Sure.
There's a big contributing factor.
So when I'm having an exam, you guys sometimes use a little probe, and I'll hear numbers. So the dentist might be saying 4, 2, 6. What is that?
All right. So What we are measuring is called tissue attachment. So on the neck of a tooth, on the root of a tooth, if you have healthy gum tissue, you're going to have a 1, 2, or a 3. So those little probes are going to go down. They have little gradations on the side, and they'll tell us how deep they go. In healthy patients, you're going to see 1, 2s, and 3s, and you're going to see no bleeding. In a really healthy patient, you're going to see primarily 1s and 2s, a few 3s, but again, no bleeding. When periodontal disease or gingivitis starts setting in, you're going to see 4s. You're going to see some more bleeding. As it advances, the probe goes deeper, and the attachment loss along the neck of the tooth increases. So you're getting deeper along the neck of the tooth, getting further away from oxygen, and those are going to turn into 5s and 6s and 7s and 10s and whatever. The deeper it is, the worse it is. And again, it's one of the things that I've always told people, the worst thing about periodontal disease is it's typically a painless progressing disease. You really don't notice it other than the bleeding gums, maybe bad breath.
Yeah. So is there anything you can do about it at that point?
Oh, yeah. There's so much. First things first, again, always go back to the idea of early prevention. It is way easier to prevent this from happening than trying to recover from it. So maintaining that relationship with your dentist and treating it early is by far the number one priority. Second to that, if you get into it, I typically tell my patients, if you're in the 4s and 5s range, we can treat those. You can see our hygienists. I always say they're the best in the state of Indiana, and they're awesome. We see great results with our patients on a very regular basis with that. We get them back into a state of what I consider health. If you're in the 5 and 6 range, it's definitely a slippery slope. You're going to have more difficult times managing it. And then beyond that, it's a real challenge. So, you're talking surgeries, you're talking laser therapy, different things. So again, early prevention or early care is key to this.
So a warning sign is if your gums bleed when you brush.
Yeah.
And then just kind of the puffy kind of look at your gums. So you should be looking at your gums.
Absolutely.
Right?
Absolutely. Again, at the risk of sounding a little bit rude, I'm amazed at what people come in and they're completely unaware of what's going on in their mouth. You talk to them and you ask them, how are your teeth? And they're like, oh, my teeth are fine. And you open up and like, oh, well, okay, did you realize this was all going on? And a lot of people have no clue. But then as soon as I point it out to them, they go home and they start looking at it like, wait a minute, I didn't know this was going on over here and there. So again, just being aware, look in your mouth.
Well, I know you're on a mission to motivate people to take care of their teeth with you or with someone else, but just to take action.
Yes.
So tell me about what people tell you when you see them. You said every week you hear from somebody who hasn't been to the dentist in months or years.
Yeah. So, there's so many, there's so many stories. The number one thing I hear is people feel guilty, they feel ashamed, they are nervous of fees, they're nervous of all kinds of things. And in whatever their big thing that's keeping away from them, all they're doing is they're getting themselves further down the road into the situation where they don't want to be. So if you're really fearful of expensive dental treatment or fearful of, a painful procedure or something like that, or a difficult procedure, well, those are the things you're heading to if you avoid the dentist on a regular basis.
Right.
Just come in early, get your teeth clean when it's easy. You might have a little filling here and there, but those are simple,
And the process is, we've talked about this before, but it seems as though in the healthcare world, technology has shifted in dentistry faster than a lot of other professions.
Yeah. Well, I'm not a physician, but I mean, in our world, it's almost hard to keep up anymore. Every time you turn around, they're coming out with something else. Everything is geared around the idea of making things, simpler, safer, faster, better, and make the experience for the patient as pleasant as possible.
Yeah. And we've gotten a lot better at pain management, right?
Yeah.
There are so many things that you can do these days that they didn't used to do. So if you haven't been to the dentist in a long time, it's a different experience.
It is different. I hear that all the time. We have, I really enjoy, sedation dentistry is a big part of what we do, and very common. People come in, they're very nervous, they're very afraid, and sometimes it takes some sedation to get them through that first appointment or 2 or 3. And then after a while, they kind of, they get through the harder procedures and they build that confidence and they build that trust, and they come in and maybe we're just using nitrous. And honestly, it's really exciting to get someone, and I can think of someone this last week that is like, I can't believe I can come here without being afraid. And so there's a lot of things we enjoy doing, but building those relationships, building that trust and seeing that transformation, that's the best stuff.
And we are back to a discussion of dental health with Dr. Dave Diehl from Dupont Family Dentistry. Some of the best conversations happen during the commercial breaks right here in the studio. So we were just talking with our producer, Heather, who says it's been, do you mind if I say this, Heather? Is this okay? She said it's been 8 years since she's been to the dentist. And part of the reason is she is giving a priority to her kids. Yeah. and spending the money and making sure they're off on a good path for dental health. Do you hear that a lot?
I hear that often, very often. And first things, I commend you as a great mom, investing in your kids' health and their dental health. And I think that's obviously a priority for all of us. And so I love seeing that, but I'd love to help you out as well.
So you mentioned here something about a monthly budget amount. Tell me how what you're thinking there.
Well, okay. So again, money is often, there's a fear, then there's the money side of it.
Of course it is.
Yeah. It's hard, but sometimes it's valuable to talk about this. Yes, okay, you can't afford all the treatment at one time. I get that. But if there's a way to budget it, there are companies that finance things for us. And if $100 a month or $200 or $300 a month sounds reasonable to you, that can really open up a lot of treatment that you can have done and treat it now. It's the best time to treat it is always now, before it gets even more expensive and more costly down the road. So, you were saying that your daughter has a $200 a month ortho bill. And, if that was something you could transition into for yourself, it's good. Invest in yourself,
Hey, a couple of messages have come in. Listen to this one. I really appreciate this segment. I'm over 60, brush and floss regularly, and visit my dentist every 6 months. My mouth and teeth are in great shape, but I've got 2 brothers who have obvious issues because they didn't do these simple things. How sad.
Yeah.
And here's another one, Dave. What is your favorite #1 toothpaste?
Always get this question.
Yeah, I'm sure you do.
I really like OxyFresh is a brand that we sell at the office. It's something that you can get through dentists. I really do like that. That's pretty much my favorite. Outside of that, I really like Colgate. If I were to go to a grocery store and pick up a brand, I'd go towards Colgate. But there's a lot of good ones.
And at what age should parents begin brushing a child's teeth?
Yeah. So, as soon as the teeth start appearing, if you can get even a finger in there and start wiping around is good. But as soon as possible to start getting some type of brushing going.
Okay. So I have a concern around flossing. That's something I'm guilty of. I don't do it as often as I should. And most people don't do it right. What are we doing wrong?
Well, not doing it.
Yeah, number one.
Number one. People talk about the idea of flossing first, then brushing, or brushing, then flossing. Flossing first is definitely a better idea. Gets things out of there. When you brush, you're going to remove it even better. So floss first, then brush.
Okay. And then as we're brushing, I saw a study that said most people brush for 30 seconds.
Yeah.
That ain't getting it done, is it?
No, not at all. No, unless you have 2 teeth. You want to be in that 2-minute range. Now, personally, for me, I'm a huge fan of Sonicare toothbrushes. So I am not paid to say this. This is based on my 20 years of experience. I tell every patient, go get a Sonicare toothbrush.
What is there about them?
Well, okay, so going back to our original conversation about these anaerobic bacteria, so Sonicares, have the sonic waves of vibrations that go through, and they force those toothpaste and the water and the air between your teeth way better than anything else. There's nothing that comes close. And getting that oxygen through the teeth with a Sonicare toothbrush is going to kill off those bacteria or demote the health of that bacteria, the stuff that you don't want to have. Sonicare, 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 all day long.
Okay. Let's jump out to the phones, Heather. What do we got?
We've got Kim on the phone. He's got a question on oral bacteria.
Okay, go right ahead. You're on with Dr. Dave Diehl.
Oral probiotics.
Oops.
There you are. Go ahead. Could you restart your question?
Yes, there are such things as oral probiotics.
Yeah, there sure are.
I just wonder if it's advisable to use those.
Yeah, I've had some experience with using those in the office over the years. We don't use it right now currently, but I think they're good. I've seen some really good results with them, and it's something that I would not shy away from at all.
Oral probiotics. What a great question. I hadn't thought of that. So tell me more about, the general concept of probiotics. Yeah,
exactly. So within your mouth, you're going to have all these different bacteria, and they're all competing for nutrients. They're all competing for survivability. And the idea of probiotics is that you're going to promote the health of the good bacteria in your mouth and competitively decrease the bad bacteria. So it's a great question and great concept, and something that we should probably do more of.
Yeah, you bet. Thanks for your call. So what do we do about? Is it a tablet I take? Is it a toothpaste?
Yeah.
How does it work?
A couple different forms of it: mouth rinses, tablets, chewables. I'm trying to remember. The one we had, I believe, was a mouth rinse.
Something I take all the time?
Yeah, again, just like probiotics you would take for your gut, it would be the same difference.
You just mentioned mouth washes, mouth rinses. Some of them are pretty harsh, and you can take the headphones off. Some of them are pretty harsh. Should I use those on a regular basis?
Yeah, I go back to OxyFresh. I really am a fan of their products. If I use Listerine myself, I do get a burning, a sloughing of tissue and stuff like that at times, and I'm just not so crazy about it. It's a good product, but I would prefer to steer towards something that's a little more holistic, a little bit more gentle on your gingiva.
So, and gingiva being the gum tissue, So let's go to let's go down the path of I've got a problem and it's gotten so bad now I'm losing teeth.
Yeah, okay.
What can you do for me here? I mean, that's got to be a stopper for a lot of people, right?
Sure. So, if we're talking in the vein of advanced periodontal disease, what you often find is some back teeth are more aggressively affected. So, you're losing a tooth or two or three or maybe a section of teeth. When those things happen, you're looking at having those teeth removed, bone graft the area, try to get the areas as healthy as possible. And after that's healed, you can look at doing implants. Dental implants are a great way to go, and basically getting individual teeth again. Partials are an option as well. Sometimes bridge work are an option as well, too.
So is that type of procedure a considered a medical case by insurance? Are they going to cover bone grafts and that kind of thing?
Not typically. That's where
what's wrong with the world?
I know. Unfortunately, certain things that we do, and it seems medical, and they won't cover it, and dental won't cover it. So there's a gray area there.
Yeah, that's uncomfortable.
It is. So
people have this fear of the cost and the pain and the time involved. What is there that's new that help you guys get past and make those procedures much more comfortable?
Well, so first things first, talk about the cost. Outside financing has become a very common part of our life. And so if the cost is prohibitive, but you could figure out a budget thing, $100, $200, $300 a month, whatever it may be, that works really well for a lot of people. So we see a lot of people using that. The fear side of things, that's where the sedation comes in, and that just simply flat out works. For us, a patient takes a Valium the night before, helps them sleep the night before. The morning of, they come in, they take another pill called Trazlam. Most people are really, really relaxed when they walk in the door and they sit down, and we typically give a little bit more than that. If we have to, we'll end up doing IV sedation. And those patients, the vast majority of them will first thing, they wake up like, are we done? They can't believe it's over.
Nice.
And second is like they're very thankful that they were asleep during the whole thing, or very not much aware of what's going on.
Dave, you're lighting things up here with the audience here. So we have another message. Somebody wants to know, is medicated floss better than regular floss?
Oh, that's a good question. I don't have a strong opinion on that. Depends on what the medication is and what they're talking about, I suppose.
Okay. Yeah, I don't know about
xylitol. Xylitol is a pretty good product. If that has xylitol in the floss, then I'm sure that's better.
Okay, that's great. So are you accepting new patients?
Absolutely, yes, all the time.
Okay, great. And am I going to see you or another doctor?
We have two other doctors that work for us, Dr. Allison Fiesel and Dr. Jason Hempel. They're both awesome. Think the world of them. They've treated my wife, let them work on me or them as well. So they're great.
If I want to see you, is that possible? Can I request?
You can request us. It gets a little tricky when people start saying, hey, I just want to see Dr. Hempel or Dr. Diehl. We try to share our patients equally and see everybody equally. But if somebody really wants to see one person, we make that happen.
Okay. And I always love to talk about the same-day smile process. We don't have a lot of time, but I think that's so significant. It makes such a change in people's life. Give me a quick overview on what you can do in one day.
So, come in. Usually it's going to be about a 6-hour appointment. We try to make them about 4, but 6 hours, you come in, sit down, get you numb, we change the way your teeth look, and by the time you walk out at the end of the day, you have a brand new smile.
And that's so important in so many different levels. We got to leave it there. That is Dr. Dave Diehl from Dupont Family Dentistry. Thank you for being here. We'll see you again soon, and I hope that you'll be back with us again next week for another edition of the HealthCall Live Radio Hour, or check us out on the podcast. You can always go to the podcast page on WOWO and find us there.